Breast reduction kills your chance to breastfeed. That's a myth. If maintaining future breastfeeding potential is a priority, then you should choose a surgeon experienced in breast reductions, discuss your personal goals during your consultation, and we take into consideration surgical techniques such as maintaining the connections to the breast tissue and to the nipple that actually help you preserve that ability to breastfeed. Now, there are studies looking at breastfeeding potential with breast surgery, and it basically comes down to some patients could never breastfeed whether they've had breast surgery or not. Same thing with patients who could breastfeed before surgery, they get the surgery, they may or may not be able to breastfeed after. And so it's a very important conversation to have with your surgeon if you're planning on future breastfeeding potential, and also the timing of like when you would want to plan the operation, because it is important for us to consider those goals as well. So some individuals just don't have the ability to breastfeed at all, and that's regardless of whether they've had breast surgery or not. It could be multifactorial. It could be something to do with the nerves. It could be something to do with the parenchymal tissue, basically the connections from the breast tissue to the overlying nipple and areolar duct. So it's kind of a multifactorial reason why some patients can't breastfeed before and after surgery. Now, after surgery, it comes down more to like based on the volume of breast tissue that's removed, or potentially the distribution of the tissue, what was removed during the surgery. Sometimes disruptions of just the ducts that are basically supplying the milk that would be present for breastfeeding. No, typically after a breast reduction surgery, if an individual cannot breastfeed and it's related to an anatomic or structural issue related to the surgery, it's possible that they would never be able to breastfeed. And there's not really a great way to restore that ability surgically. But, you know, this is a multifactorial thing. Sometimes it has to do with just the sensory elements of like suckling or other reasons why someone can't breastfeed. So it's not always related to like the surgical reason. So it's sort of multifactorial, but yeah, totally. And the reason why that we recommend that patients tell us if they're planning on getting pregnant in the near future or planning to breastfeed, or if there's any large fluctuations of weight, whether that's a significant weight gain or loss that's planned. A lot of patients are on Ozempic or some GLP-1s. Basically, the breast tissue is going to change. So if you gain a lot of weight quickly, the breasts are engorged, you know, with milk for breastfeeding, then after that process is done, the breast will basically get smaller and they may droop or hang or develop something called ptosis. And in that case, the breast tissue is completely changed. It could be, you know, softer, it could be more lax, the skin elasticity may have changed. And so in those cases of significant weight fluctuations or, you know, suddenly increasing exercise for that goal or diet changes, you really want to like communicate that with your surgeon so that they can make an appropriate medical plan for you in terms of timeline. You don't want to plan surgery until your weight has been stabilized for about 6 months, because that's kind of the time frame when all the tissues have kind of settled and they're softer, and you really get an understanding of like, this is a stable result. You also don't want to do something where you know, dramatically lose weight and you just can't maintain that long term, because we want to give you a result that you're going to be happy with and it's long term and sustainable. And so if you're, you know, kind of going through a lot of fluctuations and changes, then you're not going to be able to maintain that result. And we want to give you the best aesthetic result that we can. So being at a stable weight and stable kind of lifestyle is important for that. So if you have questions about breast reduction surgery or what constitutes medical necessity, call us at 212-427-3982 or visit us at breastsurgerygroup.com to schedule your consultation.